Okay, well, I think I'm going to go ahead and start things off. Hello, everybody. Good evening, good morning, wherever you're joining us today. It's a pleasure to see you all. My name is Haley Campbell, and I am the project director at the Global Consortium on Climate and Health Education at Columbia University. And it's my pleasure to welcome you today to today's Learning Collaborative webinar. So for those of you that are joining us the first time, Learning Collaborative webinars are kind of sessions to provide opportunities for our members to learn and share about strategies and challenges and success stories when integrating climate and health education into health professional curricula. So before we get started, I just wanted to ask everyone through the remainder of today's presentations, if you have any questions for the presenters, to just type them in to the chat, and we'll have a brief Q&A following the presentations. So yeah. So we have some very exciting presenters today who will be sharing climate and health curriculum and initiatives at their institutions. So first to present today is Dr. Gaurab Basu, who is a primary care physician and the co-director of the CRHE Center for Health Equity, Education, and Advocacy, and is also the climate change and health theme director at Harvard Medical School. And he'll be presenting alongside his colleague, Hugh Shirley. Second to present will be Dr. Stefan, who is an acting instructor of emergency medicine and an affiliate of the Center for Health and the Global Environment at University of Washington. So thank you so much to all the presenters for joining us today and for lending your expertise to this webinar. And with that, I will turn the floor over to Dr. Basu.
Haley, thanks so much. And it's great to be here with you all. Thanks for your interest and spending part of your day with us. Let me share here. You'll let me know if you can't see that. Yeah, Hugh and I are excited to tell you a little bit about what we've been working on. Thanks, Haley, for the introduction. I just want to acknowledge also that I'll mention this a little bit more when we speak, but the Students for Environmental Awareness in Medicine have been just amazing leaders. It's the local student group at Harvard Medical School. So Natalie, Eamon, Ben, Maddie, Julia, all along with Hugh have been great leaders and partners. It's been a lot of fun, honestly, to work on this together. And we just had dinner at my house, which was a lot of fun. So we were celebrating some of our progress and thinking about how to scheme into the future here. So little roadmap for what we're going to try to cover in a brief amount of time today. To talk a bit about the role of medical education. You guys don't need to hear that, you know it, but we'll just make a point of it to tell you a little bit about our team and how it works, to touch upon the national landscape, which again, I think you all know pretty well, to introduce our curriculum, present a few examples, and then explain how the medical school is trying to interface with the rest of the university, because that's kind of one of our approaches and strategies with our work. So, start by saying, the headlines are really scary. They're overwhelming. They're daunting. As a father, as a doctor, I see these things and you feel, really challenged and paralyzed, by what to do. And of course, what we know, the reason we're all here together is that climate change is fundamentally an issue of health equity. It's about taking care of our patients. So I think a core thing that we try to communicate when we're engaging with our course directors, our deans, is that this is about us being excellent doctors at the medical school. And for any professions there, I think when we make an argument that this is about us rising to the top of our calling to do what we were trained to do and to take care of our patients, and also explain the ways in which these broader forces and structural forces are critical for us to engage with and mitigate so that we can be best serving our patients. So, I think of climate change and the burning of fossil fuels, ecological degradation is impacting health equity through 8 kind of pathways. Impacts on infectious diseases, heat-related diseases, air pollution and allergens, extreme weather, food insecurity, water scarcity, mental health, enforced migration, and relatedly, questions about political conflict, especially globally. And here, when we try to explain and translate what that means for us locally here, there's a City of Boston report on heat showing that we're going from a baseline of 11 days of dangerous heat a year to 40 a year by 2030, which is right around the corner. And that increases the risks of things like strokes and heart attacks and dysregulation, diabetes, premature labor, and mental health impacts. So again, we want to really connect the dots and have this conversation with our colleagues at the medical school about why this is critical for us to deeply engage with. The Lancet Countdown has reported that 60% of global infectious diseases may increase because of climate change. And that, for me, it's almost hard. To talk about climate change as anything but an issue of health equity. I don't even kind of understand that. I mean, it is fundamentally an issue of health equity, but we've got to be documenting, reporting, spotlighting the ways in which it's playing out to hit disproportionately in communities of color and poor communities and in the global South. So redlining, Lancet showed us, has created communities that have more oil and gas wells, air pollution, heat, and less tree cover and green space. And of course, air pollution, we've really highlighted the impacts of that as well in our work. These studies showing that 1 out of 5 premature deaths, nearly 9 million deaths a year can be associated with air pollution. And again, translating that locally, you'll see some data points there of studies by Landrigan that show its impact in the Commonwealth of Massachusetts. I should have apologized. I've got a cold, so my voice is usually not this hoarse, but hopefully you'll be able to understand me. So again, when we talk, we have felt that some of the faculty feel like, wow, it's such a big issue, but what can we do? And so I kind of made a point of highlighting the role of medical education here, because I think anchoring it and really bringing it into our sense of professional responsibility is really important in training. And so climate change, of course, holds the significant implications for health equity, and the practice of medicine, that we have a trusted voice in how we can make change and make progress on this great issue, and that we have a responsibility to be teaching our students how to practice medicine on a warming planet. So let me highlight again here, this is the student group here. I mentioned all their names. I really just want to make a point that for all of you trying to work on making progress on curriculum, students have been such extraordinary leaders on this. They really changed the game. A lot of us faculty have been trying to do things. About a year and a half ago, there was a presentation to kind of an important group of medical education leaders at Harvard Medical School, and the breakthrough happened there. It was a really good presentation. Folks really responded, and that really gave us the pathway to make this progress. And then faculty obviously is critical as well. So we've developed a faculty working group here. As many of you know, Harvard has like multiple affiliate hospitals. So it's been a nice way for faculty to get together and work together in a way that they usually don't do. And what's great about this is there's diversity of experience and expertise. So we've been pulling these folks in to lend their expertise as we're developing curriculum and specific issues that Hugh will highlight. All right, let me just touch upon the national landscape, and then I'll hand it over to Hugh. So a global consortium has been a great help, and the resources they have online have helped us think through the competencies. The CFMS Heart student group in Canada had made some nice competencies that we had reviewed when we were thinking about ours. Emory has done some real leadership work, of course, and published on this, which was helpful to think about our learning objectives. And then Stefan will be presenting and has been really valuable to us. Also, this great collaboration for climate resources for health education, and a real model of how institutions can work together to put resources together. So in terms of competencies and learning objectives, there's certainly a lot being done. I have a feeling that in 5 years, this is going to blossom out big time, and we hope to contribute to that work as well. And so, this is what the AMC has shown in their cataloging of required coursework in climate change. So they've just started documenting this on climate change. They've used different terms like environmental health before and things like that. So in the United States, it's small but growing, and this is in blue pre-clerkship and then in orange clerkship. But I feel a strong confidence actually that this is really going to be that medical schools are going to feel real pressure and expectation to be implementing climate curriculum into their schools in a longitudinal way. Hugh, I'll turn it to you.
Yeah, thank you, Gaurab. Thank you all for having both of us here again. I swear normally I have more art on my walls, but my command strips are failing me, so that's why they look a little bit barren. I'm going to be talking about some of the more nitty-gritty details of our strategy when it comes to integrating climate into our curriculum here, and go through a few examples from the first year curriculum. Could you go to the next slide? Thank you. So Gaurab and the faculty team and the student group developed 5 focus areas that we use to sort of guide our integrations. They're listed here. The first is really on the pathophysiological mechanism underpinning the relationship between climate change and health. The second is more on clinical care, how you take care of patients in the context of climate change. The third is understanding the historical and structural role of climate change. And the fourth is on healthcare systems, how healthcare systems contribute to climate change, and how healthcare delivery is vulnerable to climate-related disasters. And fifth and finally, how physicians can be advocates in finding climate solutions. Next slide, please. So our workflow varies from course to course, but generally our team comes up with a few ideas. We then connect with the course director for any given course in the curriculum to share those ideas, to get their feedback, and to hear any ideas and insights they might have as to how to integrate climate into their curriculum. Generally, course directors are really receptive to this because they've heard about the theme and they want to get involved in some way. But our overall goal is then to co-develop the content with those course directors in a way that's easy for them and in a way that doesn't add a lot of extra time or burden for the students to actually engage with that material on the back end. Next slide, please. So the next 2 slides go over the progress that we've made over the last 2 years. And there's a lot of institutional acronyms here that I'll try not to bore you with, but generally, it breaks down into different segments of our curriculum here. HMS students, when they enter, are either in the Pathways curriculum or they're in the HST or Health Science and Technology curriculum. And then the PCE is it's just our clerkship year. And so there's a pre-clerkship phase and there's a post-clerkship phase. Here in 2020, we had a few integrations across the pre-clerkship phase of the Pathways curriculum in blue, as well as in the post-clerkship phase in the Course Essentials 2, and in a few of the non-clinical and clinical electives that are available to post-clerkship students in the 3rd and 4th year. Next slide, please. So by the end of 2022, we've integrated the climate theme into most of the pre-PCE Pathways courses, and we're on track to have content integrated into the last 2 courses of that curriculum, which are called MBB and Transitions, just in time for the M1s to reach that part of the curriculum. And our aim overall is not to necessarily fill every square here in blue, but rather to create a patchwork that makes sense across the areas of focus for the given content in the course, so that students have a really robust, natural, longitudinal experience with the climate content. HST, which is the other part of the HMS curriculum, is undergoing a redesign currently, and we're working with the faculty as they're doing that redesign to integrate climate from the ground up in their new curriculum. And then the clerkship phase of the curriculum, the PCE, is done across 4 different hospitals for HMS students. We're divvied up across these 4 systems, and we don't really see each other for the whole year. And it makes it logistically challenging to create climate content that reaches every student. But we're working with the faculty that lead the PCE curriculum to find ways to make that integration happen. And we have some ideas, for example, teaching students how to use heat maps to understand exposures to heat in communities served by the hospital. So those are areas that we're actively working on, and we hope to make progress on those parts of the curriculum in the next few months and years as well. Next slide, please. So now I'm going to go through a few different examples from our foundation, from our pre-PCE curriculum and how we made these integrations happen. Foundations is the first major course that M1s take, and it is sort of a hodgepodge of basic science topics, including pharmacology, biochemistry, and microbiology. In the microbiome section, there's a module on malaria, neglected tropical diseases, and vector-borne diseases. And so this slide shows how we might propose a content integration to the director of the microbiology part of the foundations course. They have a piece of content and we look at it and review it and make suggestions as to how we might simply add a few points to what already exists that covers some important climate-related concept that doesn't create too much burden for the course directors to add and doesn't add too much work for students to engage with, but nevertheless further reinforces their understanding of how climate change intersects with the topic of malaria in this case. Next slide. H1 or homeostasis 1 is our block that focuses on cardio, palm, and heme. In the past, there was a case on a child with asthma, and we worked closely with the course directors to sort of reinvent this case that already existed to highlight issues of environmental justice, exposure to air pollution, and how those things relate pathophysiologically to asthma. And in addition to reworking the case, the students from SEAM also put together a video that reviews really nicely the pathophysiology behind particulate matter, PM 2.5, and its impact on lung diseases such as asthma. Next slide, please. H2 or homeostasis 2 is our renal, endocrine, and GI block. This block historically has had an optional lecture on Mesoamerican nephropathy and its links to exposure to extreme heat. But the course director was really excited about potentially adding more content related to the climate change theme across the renal section of the course. So we worked closely with her to integrate a case on access to dialysis during extreme weather events, as well as some questions during exams and in the assessment period to further reinforce that concept, as well as some information on the pharmacology of ACE inhibitors and ARBs and how that can relate to extreme heat. Next slide, please. FCC, which is our foundational continuity clinic. It's the first year's opportunity to work with a primary care physician in a clinical setting. In this course, we introduced this interactive heat screening module for students to take to their clinic and practice with their preceptors and use with students, with their patients. Yeah, next slide, please. And finally, in Introduction to the Profession and Essentials, ITP is the first course that M1s participate in, their first week of med school. On the second day, Gaurab, this past year, led a session on physician advocacy around climate change. And he shared his personal journey into climate advocacy work and shared his story. And then he had two of my colleagues come and lead a panel on student advocacy related to climate change. And that's what's shown in the picture on the left there. And in the right, this picture is from Essentials, which is broken into two courses, Essentials 1 and Essentials 2. The first happens before our clerkship year and the second happens afterwards. This course focuses on social justice, health policy, biostatistics, and medical ethics. And we worked closely with the faculty in the social medicine part of the course to integrate a lot of content related to climate change throughout their curriculum. We also had a few special sessions, one with Gina McCarthy, who's pictured here, who held a talk for the students in the course, and then one with Dr. Ari Bernstein for the Essentials 2 students. He's one of our climate faculty who works closely with us and advises us on the whole project. So those are a few examples throughout the first and a little bit into the second year curriculum that we've been able to integrate. Back to you, Gaurab.
Thanks, Hugh. I'll just close up here briefly just to say, you know, a couple of our lessons learned. We really think we're a work in progress. We've got a lot to learn how to continue to do this. But there was a lot of interest from course directors. That was kind of a surprise. It was a welcome surprise. Usually, course directors are actually asking for more than we even suggested. We were asking for a lot, actually. And that integrating into existing curriculum, our goal is to go to course directors and say, we want, by integrating climate material into your course, we want you to serve your course aims even better because of that, and because of the bigness and the intersectionality of climate change and the way it touches everything in medicine. I think it's really easy to be adaptable to the various contents and frameworks and models and pedagogies of different courses. I'm going to skip this. Let me just mention that we're trying. These are a lot of acronyms here, but we're trying to, as Hugh said, integrate it into all phases. We're confident we'll be able to do that. We're doing faculty development sessions, working on mentored projects, summer program. The curriculum changed so that there'll be 2 months of summer now for first-year students. So thinking about that, and then kind of enhanced electives and selectives for fourth years. Being a theme, we actually think that's a really valuable approach. We've gotten support from the Office of Medical Education, really enhances the longitudinality and durability. And the formality of being a formal recognized theme has helped us. It changes the interface with course directors. Just a quick word, we're trying to, at the med school do this work, but really connect into what's happening at the HMS hospitals. There is some really great leadership, honestly, at those hospitals. And so we're trying to create an ecosystem in which we're connecting, cross-collaborating. Our faculty, again, are kind of spread among the different hospitals, connecting with residents and things like that. And at the med school, at the university, the Salat Institute just launched. So there's a lot of initiatives across the various schools. So, we've had an opportunity to go to the business school and the law school, teach about the health implications of climate change to different disciplines. And we really want to be, real strong leaders in that kind of interdisciplinary space. We'd love something like a cross-disciplinary educational program or master's or something like that. And we, there's the internal work of putting together a good program, but we do have an agenda, as you all are doing, to really articulate the importance of this and really change the kind of culture and expectations of medical schools doing this work. All right, that's what we've got. I'll pass it back to Haley and look forward to taking some questions after Dr. Wheat speaks.
Thank you so much, Dr. Basu and Hugh. I think your sort of strategy is really a great example to show how, including climate competencies really enhances pre-existing medical education. So I thank you for your work, and I really hope it does bloom, sort of as you mentioned, Dr. Basu. So with that, I'll turn the microphone over to Stefan and his colleague, Kate Tokareva, who I forgot to mention earlier. My apologies, Kate. You guys have the floor.
Great. All right. Let me share. Can you see my screen all right?
Looks good.
All right, sounds good. Well, hi everyone. Thank you so much for having us, Haley, into the GCCHE. I'm personally really honored to be here and get to speak alongside Dr. Basu, who is, one of my personal heroes in this space. So, and I also want to thank him for kind of helping to set the stage for some of the importance of this work and sharing some of the strategy that Harvard is undertaking. I'm excited to have a discussion with you and hear more about what you're doing. We're really excited to get to share some of our experience with you at the University of Washington as well. As Haley mentioned, my name is Stefan Wheat, and I'm an acting instructor in the Department of Emergency Medicine at the University of Washington, and I work with the Center for the Health and Global Environment at the University of Washington to tackle some of these issues. And I'm joined by Kate, who is a second-year medical student here at the University of Washington. And I'll just say, speaking goals here are just simply to tell our story, provide some insight into our process, and offer some lessons learned. And with that, I'm going to turn it over to Kate to start us off.
Awesome. Thank you so much, Stefan, for the opportunity to be here. And I'm excited to speak to all of you about my student perspective on the planetary health journey at the UW School of Medicine. So essentially, this is kind of new for us. There was student interest a couple years ago, and the University of Washington is a regional school, so we're spread across Montana, Wyoming, Washington, Alaska. And it all started with a group of students at the Montana Foundation site that realized, they really weren't getting as much education in their required preclinical curriculum on climate change and health. And one way they decided to get involved is through the Planetary Health Report Card, which many of you, I'm sure, are familiar with, but for those that are not, it's essentially a student-run, now international organization that provides a way for students to audit their own schools across various domains, such as research, curriculum, community outreach, support for student-led initiatives, and then campus sustainability, and see how their school is doing. And then this report gets published at the end of the year and kind of compares all the different schools. And when UW joined this in 2020 to 2021 curriculum year, we realized that the curriculum section was consistently the lowest scoring. And so students decided to focus their efforts on addressing that. And we can move on to the next slide, Stefan. So this kind of is a graph that shows where UW as a school stood with regards to curriculum compared to other medical schools that participated in the Planetary Health Report Card. We're highlighted in orange over here, so definitely on the lower end of the score. And students essentially took this data and brought it to faculty, different work groups and committee members, and administrators at the University of Washington, and it was well received. A lot of faculty were supportive, but I think one issue that we really ran into was just finding a way to integrate additional content into an already very packed preclinical curriculum. So we can move on to the next slide. And these are just snippets from the 3 years that the UW School of Medicine has participated in the Planetary Health Report Card. We can see that the curriculum section jumped up a grade this past most recent year, but it was quite low scoring at the beginning. And this was due to the fact that there really wasn't any explicit content on climate change and health within the core University of Washington School of Medicine curriculum. There are some electives, such as the One Health elective offered to clinical students that was planetary health adjacent, and a tropical medicine elective that touched on the impacts of climate change on infectious disease patterns, but it was severely lacking in the general curriculum. And then we can move on to the next slide. So all of this was brought to faculty, and essentially because of the student interest and the data that showed how the UW curriculum compared to other schools across the nation, a planetary health work group was founded consisting of both faculty and students. And it coincided at the same time as a total revamping of the preclinical curriculum in the past year. So one thing that we realized was really important to do was essentially an audit of what currently exists in our curriculum to see where we're starting with, and what gaps need to be filled. And through doing that audit and assessing for climate change and health content in the curriculum, we realized that there were several lectures that had been added into the new curriculum, such as one titled Justice, Climate Change, and Infectious Disease within our themes in medicine, which is like a thread that goes across multiple blocks within the preclinical phase and connects the blocks together, that explicitly touched on climate change impacts as they related to infectious disease and also environmental justice. So that was a pretty big win. And then also the development of a climate change in lung health and a climate change in kidney health session in the respiratory and renal blocks that was still in the development for the incoming first years. And then on top of that, of course, another win was the UW formally joining the GCCHE. So over the course of the past couple of years that students were involved with the Planetary Health Report Card, the wheels did get set in motion on creating long-term changes, but obviously, there's a lot of work that still needs to be done, and the creation of the Planetary Health Work Group at the University of Washington has really been instrumental in getting the wheels turned and continuing in the right direction. We can move on to the next slide. So looking ahead, I guess from the student perspective, what we think is really important is finding a way to balance the fact that, we're already dealing with studying for board exams. We have a jam-packed curriculum, and finding a way to tactfully integrate climate change health impacts without really taking anything else out. And the approach that we think is best is really finding areas that currently exist in certain blocks, which pretty much are all of them that relate to climate change and health, and finding ways to incorporate climate change health impacts into them. So for example, in a cardiovascular block, if we're already touching on the impact of extreme heat on the cardiovascular system, really explicitly adding that additional tie on how climate change leads to more extreme heat events, and adding the data that we already have from previous heat waves and the impacts on patient populations, and really just finding a way to tactfully add climate change ties to existing content in a longitudinal way. And we have threads called Themes in Medicine or Medicine in Society that are recurring lectures in between blocks that tie blocks together. And through the work of the Planetary Health Work Group, we realized that this is probably a good next step, and a practical way to tie in longitudinal content in a way that doesn't overwhelm the faculty teaching different blocks, but also gives students that opportunity to make connections across multiple blocks. Another idea that we have moving forward is really introducing planetary health early on, such as during orientation for first years, and then also looking towards addressing planetary health content in the clinical curriculum, although as the previous talk touched on, this is a bit more challenging as students are often spread out across clinical sites. And just to wrap things up from the student perspective, one thing I wanted to add was that, we realize that not everyone is going to be super gung-ho about climate change health impacts. Like, it's not going to be everyone's niche, but we really think it's important for climate change health impacts and planetary health to find a space in the required core clinical curriculum, while at the same time providing those opportunities like additional electives on healthcare sustainability, or something that we're looking to develop is a planetary health pathway at UW, where students interested in further advocating for climate justice and really making that a part of their future work have the opportunity to take those additional classes and have those extracurricular experiences and get recognized for it. And I guess just from my perspective, I'm really inspired by how the faculty have, really listened to what the students brought up, created the whole work group, and it's been really exciting to be a part of it from the beginning of the year up until now, and seeing all the changes that have been set in motion. So with that, I'll just pass it on back to you, Stefan. I think you're muted, by the way.
Okay, great. Hi. Yeah. Thanks, Kate. I really appreciate it. And yeah, so I'm going to take over now, and I'm just going to more broadly kind of speak to kind of those 50,000-foot view lessons that we've learned. And I think that these are lessons that can be broadly applied to pretty much any institution that is thinking about trying to integrate these this content into their health education schools. And as I think you can see, the first lesson that I'd like to start with is to start with students. I'm really glad to have Kate here with us, and she's been a leader here at the University of Washington, helping to kind of help us reimagine what medical education could look like when it starts to account for planetary health. Let's see. And we see again, this not just happening in curriculum, but happening in the academic world as well. We see this in paper after paper. Here from one of our national leaders in climate and health education, Dr. Phillipsborn. We see this happening in other parts of the world, in Canada, for example, here, where students are really at the vanguard of this movement, and they're helping to kind of move the dial and forcing the powers that be to take this material seriously. And when I say, I think we need to start with students, I don't really mean that idly. I mean that students really have to be active stakeholders in the development of these types of curricula. And they not only bring this, I think really infectious energy to the process that I think we all thrive on, especially, from the standpoint of faculty, but they also bring really essential knowledge. They know what the curriculum looks like, and where we need to improve on. They know where planetary health content already exists and where it needs to be developed further. But they can also provide really essential insight into the modalities of medical teaching, which which can help us to think about how this content can be integrated. And I think the reality that we all have to face, especially as we're a few years out of medical school, is that how we educate students, and medical students in particular, is kind of a moving target. And I think it's really valuable to involve students as they can help us think about what is the most effective way to do that. And perhaps the most important contribution of students is that they've been the de facto leaders in the needs assessment for planetary health education for healthcare education institutions all over the world through the Planetary Health Report Card. And I think most everyone here is familiar with the Planetary Health Report Card to varying degrees, but I think it bears mentioning how important this is for getting your institution's attention. Showing your deans and your curriculum committees that this is being done elsewhere, and that your institution may be falling behind the 8 ball, really puts them on notice. And I think that really was the case here at the University of Washington, and I think that's why we are pushing this forward in a way that it hasn't been done before. So big credit going out to the people who created that, some of who I know are on the call here. And here's the Planetary Health Report Card assessment for the University of Washington on all components other than curriculum. And as Kate mentioned already, we're doing okay actually for a lot of these other components. Obviously room for improvement, but the reality that we saw was that whereas we were doing okay for interdisciplinary research and maybe sustainability and student-led initiatives, where we were really lacking was curriculum. And unfortunately, but fortunately, this is what we're all here for. And I think what's important to remember about account taking like the Planetary Health Report Card is that it's not only useful as a needs assessment to help us identify where the gaps in our institutions exist. For better or worse, the reality that I think we find ourselves in is that institutions around the country there are many institutions around the country who are working on this problem, but there really isn't a standardized set of learning objectives that for undergraduate medical learners around planetary health and climate change. So, the Planetary Health Report Card can be used as a needs assessment, but it can also be used as a starting point to think about some of the, key content areas that need to be included in your curriculum. The next important lesson that I think I'd like to impart here is that you shouldn't be tackling this alone. Well, some of us may have our qualms with committee team style work, endless email chains and Zoom meetings with 50 plus people, all of whom are trying to get their thoughts in and get their ideas heard. This is the kind of work that really does benefit from a coalition. So you'll be surprised at how many people at your institution are interested and invested in bringing this content and information to learners. So I do encourage you to reach out to others and try and find your people who are working on this. Here at the University of Washington, we've benefited from the inclusion of a wide variety of amazing experts in planetary health, who've all kind of combined to form this planetary health working group that Kate was mentioning. And some important stakeholders you may want to consider including as you tackle this at your institution include, of course, first and foremost, students, but also subject matter experts who can speak authoritatively on the content that needs to be covered, medical education experts that can help with modalities of education and assessment that could be applied to the integration of planetary health content, curriculum development experts, and then finally, and maybe most importantly in some of the work that I've been doing on this recently at the university, is leaders. Really know the things of your school and your school of medicine and what it's going to take to get something like this across the finish line. So involve those people early, and you're going to thank yourself in the long run. The next lesson is to establish your goals. Ask yourself, what is the scope of the curriculum you're trying to impart? And I think this should be a conversation between yourself and the team you've developed at your institution. The expertise that your team brings to the table should help inform what the scope of your curriculum looks like. And for example, here at the University of Washington, we have some amazing people who do One Health work, and they've been helping to lead from the beginning. I'm going to skip over this, but this is all again to say that there are leaders in One Health and planetary health and climate health and eco health. The environmental health movement has been a moving target, and people have been entering this space from different disciplines for a long time, and all of them have an important voice that can play a role here and are maybe important stakeholders who you want to involve at your school. The next point that I'd like to make is to ask for help. There exists a really rich network of people who are considering how to address this very same issue that we at the University of Washington are trying to figure out, that our colleagues who are joining us from Harvard are a little bit further along the path in developing, but all over the country, people are asking this question: how do we do this effectively? And you don't need to start from scratch. There are other people you can reach out to. And the really amazing thing is that I think, in my experience, everyone that I've encountered who works on this issue is just so welcoming and warm and wants to be able to help wherever they can. And I'll say that the Climate Resources for Health Education, which many of you are probably familiar with here, does offer a platform through which you can learn more about this and ask questions as they arise. Because I think the reality is that, we don't want to create a situation where everyone is creating the exact same curriculum, because the diversity of how this can look is really, really valuable. But there are always going to be questions that, a colleague, in Boston or a colleague in Atlanta can help you answer. And reaching out through channels like Slack, which the CRHE has recently created a Slack channel to help, kind of facilitate and create a platform where people can ask these questions of other like-minded individuals. Those resources are out there, and I encourage you to tap into them. And next, I'd say, this is a really, really big task, and you don't have to be doing it alone. We shouldn't be doing this alone, and we need to break this down into distinct tasks that we can then lean on our teams to support us in tackling. Here at the University of Washington, our planetary health curriculum work group has developed 5 subgroups to kind of help divvy up this, relatively gargantuan task into more digestible bites. And those subgroups include a group that is reviewing where climate change and planetary health content already exists in the School of Medicine, a group that is developing learning objectives for climate change and planetary health curriculum, a group that develops a philosophy of planetary health and curriculum design, as well as an assessment group, and a group that is specifically thinking about how do you go about faculty development to help involve the faculty, solicit their feedback and input, and get them to get on board with this kind of content. I think finally, I think we need to build on what's already there. Environmental health, climate change and health, planetary health, these are all hugely important topics, and aspects of each of them are important for integration into undergraduate medical education. But when we think about how we can do this best, we really needn't start from scratch. In some ways, reimagining medical education to include climate and planetary health concepts requires a paradigm shift, but fortunately for us, this is not the first time that medical education has had to be updated, right? The scaffolding for how this has been done effectively already exists. We can benefit from looking back to the development of social medicine and, the integration of concepts like the social determinants of health, and how that has had to be a longitudinal integrated curriculum throughout most medical schools all across the country to learn about how we can effectively do this in medical schools for climate change and planetary health. And the last point I'll make is that we have to recognize and appreciate the demand that exists for time in medical schools. Medical student education is a precious and ultimately finite resource. When we approach curriculum committees and deans, we need to do so from an approach that is respectful of that reality. That means not asking them to reinvent their curriculum around your designs. It means being adaptable and non-interruptive with our approaches, and tools like the CRHE are built around this principle and are a good starting point for how you can think about getting this done. And with that, I will end, and I'm looking forward to a good discussion, and I'll post my email in the chat as well if anyone wants to reach out to any questions outside of the session.
Great. Thank you so much, Stefan and Kate. And thank you for highlighting the absolutely sort of critical and influential role that students play in all of this, as well as the importance of collaboration in this space. I remember I heard one time that like transformative climate action comes from attending really, really boring meetings. And in my experience, that's pretty true. But anyways, we have some great questions here in the chat. And I think this first one can be posed to presenters at either institution. It's from John, and he asks, did either of the presenters consider creating a separate required learning module or course versus incorporating it into the existing curriculum, climate change competencies?
I can speak to it quickly. We wanted to integrate into existing for a variety of reasons, because I think more than anything, I think the goal here is to create a practice. I definitely want people to remember statistics and mechanisms and, content. That's important, that people understand information. But I think what's the longer term commitment is a practice of understanding how these factors impact health, right? And so if we're scrutinizing, as Stefan was saying, things are changing, this is about us adapting our practice and adapting our sense of responsibility to be engaging with the broader factors at play here. So I think creating longitudinality, we were concerned about having a separate thing being like, all right, this is the climate talk, now get back to medicine. We really want this to be intertwined and longitudinal.
Yeah, I'll echo that as well. I'll say that if there are two words that are thrown around the most when we are thinking about our curriculum here at the University of Washington, it's integrated and longitudinal. We want this to the integration of this content to reflect the fact that climate change realistically impacts pretty much every disease process that you can think of. And I think the best way of conveying that is to, just have it inserted into essentially every course in little ways. And again, I think the most important thing, and that was already highlighted by a couple of our speakers here today, is that I think it's much, much harder when you consider the value of that time and how finite that time is to go to your dean and say, I need a month or I need 2 weeks to teach this course. It's much easier, it's a much more palatable ask when you go to those curriculum committees and deans and say, we're going to work with your faculty to make this relatively non-interruptive. It's going to be, we're going to add to what they already have. We're not going to take up more time.
All right, excellent. Thank you both. Jennifer asked sort of a two-pronged question, but I think I want to pose the second half first. She's wondering how much training of faculty was needed, and if this were to happen when you were designing the materials, if there was any specific, faculty training for these initiatives. And I'm also just personally wondering if you could talk a little bit about interacting with faculty who may just feel hesitant to step into this space as they don't really feel like subject experts? And I guess
I
I'll
can start by saying
Gaurab.
that
Yeah. Oh.
at least here at HMS, SEAM is holding, or we're participating in the faculty development session in the next few weeks, which is where we have an opportunity to talk to a large group of faculty about our process and to get them familiar with how we hope to integrate climate into the curriculum. And another thing we benefit from, is having our large faculty working group to serve as the content experts as we're developing the content that might be able to step in and kind of support the course directors in that hesitance that they might have.
Yeah, I actually think this interface, at least at HMS, course directors, I've been a course director in the social medicine course. Course directors like have the power of deciding what is inside of there. And if you can get the buy-in there, that's the critical access point. I'll make a quick broader point. I think faculty development is critical in all of this. This storytelling work, Marshall Ganz's work is really influential to me, of creating shared values and storytelling and making feeling like you're collaborating together. I mean, intentionality in that kind of collaboration, I think, is critical. Our experience has been that the course directors have been terrific. And I think with intentionality, me, one of the students, course director, and sometimes one of the faculty experts, like we kind of prompt with a conversation of why we're concerned about this and why it matters, in the kind of domain that we're talking about. Like that primer, I actually think what's happening is that most people are very worried about it. Course directors aren't sure what to do about it in their work. And we're offering an opportunity for them to make a contribution to the broader work. And they feel very supported, as Hugh said, by the students, by the faculty. We want to like offload concern or and what happens, that opens them up. They often, they're the expert, or, the nephrologist that we're working with is amazing. And she's like, well, what's going to happen with dialysis, So there's a cool interface that can happen. And I would argue that's actually one of the most important things to bring just as a part of strategy and approach, is to bring some intentionality to that interface, because it can really, it can make or break it, I think.
And I think from our end, Haley, that is a premature question, and we'll have to get back to the team, because I think that is not something, engaging all of the faculty who are currently teaching in the School of Medicine is not at the point where we've gotten to yet, but we'll keep you updated.
Great. I will be listening. Dr. Basu, just to kind of go off of that, are you sort of saying like these professionals who are helping you build out this course content, like although they are not climate experts, they are healthcare specialists. And so when you're kind of weaving in those competencies, it is very easily kind of applicable, I guess, like in terms of finding the common ground is what is really what really speaks to them.
Yeah, I mean, I think this is, inherently, first and foremost, a moral issue that we're working on. And it's an intellectually challenging one too. What do you do with diuretics in the summertime? What do you do about natural disasters and delivery of care? Like, they're hard, thorny questions. I think, health professionals, doctors like to think and fix things. And I have found they have gotten quite engaged about, wait a minute, why aren't we thinking about these things? And once you open that up, they have we have expertise that they don't have, but they have expertise we don't have. And I learn a lot from them. I mean, I think some of the specialists and, surgeons have been some great partners, because they have really taken on the kind of inquiry nature of this. And that creates a lot of creative energy.
Mm-hmm. Okay, great. Thank you. There's a question here from Jerry, and I think this could definitely be posed to both institutions. So as you're integrating impacts into existing curriculum, how did you handle or, go about introducing sort of the foundational, just like the climate change 101 content? Did you do it separately or as a module? I'm curious myself as well, yeah.
So the way that we are planning on doing that here at the University of Washington is that we have, blocks, and then we have kind of longitudinal courses in the preclinical period. And one of those courses, which Kate, you can mention this as well, and I'm sure you have insight on this as well, the Medicine Society Health course, which we're hoping to be able to integrate some of those basic, introductory principles into. And I think where some of those principles are already highlighted, but I'm interested to hear from Gaurab as well.
Yeah, Hugh, I'm thinking about our meeting this morning with MBB. So I'll briefly just touch on it. Maybe you can add to it, Hugh. But we want to do mental health and climate, and so there's the course where that mental health psychiatry is introduced to first-year students. They have these 6 modules of basic introduction to psychiatric. So there's one that is anxiety and PTSD, and then they have a tutorial. They have a patient come in and talk, and a debrief. And so what we landed on was that actually, we could maybe implement some element of, disaster climate impacts and how it impacts that. So, we're not going to take over that 2-hour session and make it a climate, disasters and mental health, but we are embedding in a possibility of, like, in the debrief, to have a vignette and to tie the learnings of that lecture into this lens of climate. And so that's an example. I think the basic content is an opportunity. Hugh showed you the malaria, right? That was a small insert to have that red text saying, hey, by the way, drought, flooding, temperature change, mosquitoes will change with all that. They can be small, and that creates that consciousness, I think, while you're digging into the basic information.
And I'll just add really quickly. So when I went through the first year curriculum last year, we did have just a basic lecture on an introduction to climate change and health impacts. And I believe, if I'm remembering correctly, it was about 1 hour to 2 hours long, where the instructor just went over the basics to get everyone up to speed, like what is climate change? Like, it sounds rudimentary, but I think it in a way is necessary, just because everyone's coming from different backgrounds and experiences, just to set the stage. And like I mentioned earlier, the UW preclinical curriculum went through a whole revamping process over the past year. And I believe now there's a plan to move that lecture, at least some sort of introduction to planetary health lecture, during orientation week, which would really set the stage and tell students, this is something that we take seriously within the curriculum, and it just gets everyone up to speed at the beginning of embarking on the preclinical education phase. So that was my experience.
Great, thank you so much. And I just think in the interest of time, we should probably close out, but thank you to both institutions for sharing your climate and planetary health curriculum initiatives today. And just for everyone's awareness, I'll be posting the recording and the presentation slide decks from today in the Consortium Learning Collaborative website, so you can view all the materials asynchronously after. But yeah, and with that, I think we're good to close out. So thank you all again to the presenters for joining us today. And I hope everybody has a great evening, morning, afternoon, wherever you are.
Thanks, Haley.
Thank you.
All right, take care, everybody.